I'm a chronic pain patient as well. I have neuropathy. I wanted to reiterate that the Michigan Medical Marijuana Act defines what a caregiver is, what a patient is, what they can do, where they can do it, and how they can do it. Any ordinance you pass which conflicts with that law, of course, we'll have to challenge it. I'm saying that with advice of my attorneys, that we have 4 of them. But I wanted to address something else. There are 89 unique compounds called cannabinoids in marijuana. These 89 compounds are unique. They're antiviral, antibacterial, anti-tumor, anti-everything. It's the only drug ever to reverse the effects of MS. They actually did a study with mice. And these mice were infected with the worst MS you could get. And they tried every medication on them. Marijuana was the only drug to not only stop the progression of MS, but reverse it. You should talk to Renee. She's been living with MS for 31 years as a spokesman for us. To address the lady's question about medical marijuana and the margins, I have passed in every single county in Michigan by the largest margins ever for any referendum ever put on the ballot. So it was, it's widely accepted 62.7% vote. She made a point of saying that there were alternatives. No, there isn't. There are no alternatives to marijuana. They have made several synthetic drugs. They do not function the same as marijuana. They do not produce the same results because they don't have things like the 89 unique compounds, the cannabinoids. They don't have the flavonoids or the terpenoids that marijuana have. Once we get out of the cannabinoids, we have to go into flavonoids and terpenoids. And the antioxidants, antibacterial, antivirals that are found there are unique compounds too. So what we have to do is quit demonizing marijuana because of something J. Randolph Hearst did back in the 30s because he had an interest in the pine trees. And what we have to do is start looking at the science and what it's doing for sick people. I deal every day with people who are staring death in the face. They do not want me, they don't want you, or anybody else telling them what to do. My job is, if I can give them one good day to sit up with their family, laugh, talk, have a good time, maybe even eat, then I've done my job. Because that's the day they wouldn't have. And there are no medicines out there for a lot of our patients that produce those results. I know, I've had to say goodbye to some friends. But guess what? All the way up till the end, they were a lot better shape than if they'd been pouring that poison that the pharmaceutical companies pump out. If you just take, let's just take Vicodin. You take Vicodin in your whole life, you're not going to have a liver. You're going to die from liver failure. Not from your pain, not from your disease. And almost every pharmaceutical Lipitor. They did studies on Lipitor. Lipitor does not prolong your life. It takes money out of your wallet. But there was no decrease in heart failures. And that's one of the largest medications sold in America. Marijuana lowers your cholesterol, lowers your triglycerides, normalizes blood sugar. These things have been tested by Harvard, Purdue, Yale, all the Ivy League schools. So it's really important that we not start saying the word marijuana, but that we start saying marijuana, cannabis, just like they're any other medicine. And that's the way we look at them. And we start dealing with the patients and making the patient's lives easier and not putting stress on them.